Hi, I'm Dr. Nova Rodriguez, your trusted guide behind life health secrets, dedicated to simplifying complex medical topics into clear, practical advice. My mission is to help you understand your body and take control of your health, one simple secret at a time. Close your eyes for a moment. Imagine something smaller than a grain of sand, so small you cannot see it, so silent you cannot feel it. And yet, it carries a heartbeat waiting to happen. Eyes waiting to open, tiny hands that will one day hold yours. Pregnancy does not begin with a baby bump. It begins in silence. Today, we are going deep inside the body, week by week, from week 1 to week 4. What is happening? Why do you feel strange? When does life truly begin? And why are these weeks the most powerful weeks of all? Stay with me, because what happens in these 28 days changes everything. The week 1, you're not pregnant yet, but your body is preparing. Many people are shocked when they hear this. Week 1 of pregnancy, you are not actually pregnant yet. Doctors calculate pregnancy from the first day of your last menstrual period. Why? Because ovulation and fertilization are hard to pinpoint exactly. So medically, pregnancy starts before conception. What is happening in week 1? Your body is finishing your last menstrual cycle. Your uterus is shedding its old lining. Hormones like estrogen and progesterone are low. Your body is preparing to release a new egg. Emotionally, this week may feel like fatigue, mild cramps, mood swings, bleeding, your period. But behind the scenes, your brain, hypothalamus and pituitary gland, is sending signals to your ovaries. FSH, follicle-stimulating hormone, begins rising. This hormone tells your ovaries, it's time. Prepare an egg. Emotional angle. A woman sitting at home, thinking it's just another period. She has no idea. Her body is preparing for something that could change her life forever. Pregnancy begins before you even know you want it. Week 2, ovulation, the window of creation. Week 2 is powerful. Around day 14 in a 28-day cycle, ovulation happens. One ovary releases one mature egg. This egg lives for about 12-24 hours. That's it. Just one day. Meanwhile, sperm can live inside the female body for up to 5 days. If intercourse happens during this fertile window, a race begins. What happens? During fertilization, inside the fallopian tube, millions of sperm travel. Only a few hundred reach the egg. Only one penetrates it. The moment sperm enters the egg closes itself off to other sperm. Genetic material combines. 23 chromosomes from mother, plus 23 from father. 46 chromosomes. And just like that, a new human blueprint is formed. Eye color, hair type, height potential, even personality tendencies, all coded in that instant. Emotional story. A couple falls asleep that night. They don't feel anything different. But inside her fallopian tube, 2 microscopic cells have just become one. And that single cell already knows whether it will be a boy or girl. Life begins quietly. Week 3, the miracle of implantation. Now we are officially pregnant. The fertilized egg is called a zygote. As it travels toward the uterus, it divides rapidly. 1 cell, 2 cells, 4 cells, 8 cells, 16 cells. Within 3 to 5 days, it becomes a blastocyst. This tiny ball of about 100 cells reaches the uterus. Now comes a critical moment. Implantation. The blastocyst burrows into the uterine lining. This is when pregnancy truly attaches. What is happening inside the body? Once implantation occurs, the body starts producing HCG, human chorionic gonadotropin. This is the hormone detected in pregnancy tests. HCG tells your body, do not shed the uterine lining. Protect this pregnancy. Progesterone levels rise. The uterus becomes soft and rich in blood vessels. The placenta begins forming. Symptoms in week 3. Some women feel light spotting, implantation bleeding, mild cramps, breast tenderness, slight fatigue, but many feel nothing at all. And that's the mystery. Your body is building life. but you may still think everything is normal. A woman drinks coffee. She goes to work. She exercises. Not knowing. There is now a tiny cluster of cells attaching to her womb. This is the most delicate time. Most miscarriages happen before a woman even knows she is pregnant. That's how fragile and powerful week 3 is. Week 4, the first missed period. Now things start changing. If implantation was successful, HCG levels double every 48-72 hours. This is when a pregnancy test can turn positive. And emotionally, this is the week everything changes. What is forming in week 4? Your baby is now the size of a poppy seed. But look what is already happening. The neural tube is forming. Future brain and spinal cord. The heart begins to form. The placenta develops further. The amniotic sac forms. Umbilical cord beginnings appear. The embryo has 3 layers: ectoderm, brain, skin, eyes, mesoderm, heart, muscles, bones, endoderm, lungs, liver, digestive system, all this in something smaller than a grain of rice. Hormonal changes in the mother, HCG rising, nausea begins, progesterone rising, fatigue, estrogen rising, breast changes, increased blood flow, bloating, common symptoms, missed period, nausea, morning sickness can start early, frequent urination, emotional sensitivity, heightened smell, food aversions. Emotional story. She stands in the bathroom, holding a small white stick. 2 lines appear. Her hands start shaking. Maybe she smiles. Maybe she cries. Maybe she feels fear. But in that moment, her body already knew weeks ago. Medical explanation section. Let's go deeper scientifically. During weeks 1-4, cell differentiation begins. Placental circulation begins. Hormonal axis shifts dramatically. Immune system adapts to prevent rejecting embryo. Blood volume starts gradually increasing. Folic acid becomes critical now. Why? Because neural tube closure happens around week 4. Lack of folate can cause neural tube defects like spina bifida. That's why doctors recommend prenatal vitamins before pregnancy. Common questions. Section. Can you feel pregnant in week 1? No. Can stress affect implantation? Yes. Severe stress may influence hormonal balance. Can you have symptoms before a positive test? Yes, due to progesterone rise. When does the heart start beating? Heart development begins in week 4-5. Heart-touching closing story. Let me tell you about Maria. She had 3 negative pregnancy tests before. This time, she didn't expect anything. When she missed her period, she waited. She was afraid to hope again, but inside her, for 4 weeks, cells were dividing, hormones were rising, a future was forming. Sometimes the most powerful transformations happen silently. Pregnancy is not loud in the beginning. It whispers, and those whispers turn into heartbeats. If you are in week 1-4 right now, 1. Start or continue. Folic acid immediately. Folic acid helps prevent serious brain and spinal cord defects because the neural tube forms in the first 4 weeks, even before many women know they are pregnant. You can get it from prenatal vitamins, leafy greens, lentils, fortified cereals, but supplements are very important during this time. 2. Avoid harmful substances. During weeks 1-4, the baby is extremely sensitive. Avoid smoking, alcohol, recreational drugs, unnecessary medications, exposure to harmful chemicals, pesticides, strong cleaning agents. If she is taking any regular medicine, she should consult a doctor before continuing it. 3. Do not take random medicines. Even common painkillers should not be taken without medical advice. Always check with a healthcare provider before. Antibiotics, herbal remedies, over-the-counter medicines. Early development is happening rapidly. 4. Eat clean and safe food. Focus on fresh fruits and vegetables, well-cooked meat and eggs, pasteurized dairy. Avoid raw meat or fish, unpasteurized milk, street food with poor hygiene. Food poisoning can be risky during early pregnancy. 5. Limit caffeine. Keep caffeine below 200 milligars per day, about 1 cup of coffee. Too much caffeine may increase miscarriage risk. 6. Rest and reduce stress. Hormones are changing quickly. Fatigue is common. Encourage proper sleep. Light walking. Deep breathing. Avoiding emotional stress. A calm mother supports a healthy pregnancy. 7. Schedule first prenatal visit. As soon as pregnancy is suspected, confirm with a pregnancy test. Book first doctor appointment. Discuss medical history. Check blood group, hemoglobin, thyroid, etc. Early monitoring prevents complications. 8. Watch for warning signs. Seek medical help if there is heavy bleeding, severe abdominal pain, high fever, severe dizziness. Mild cramps and light spotting can be normal, but heavy symptoms need attention. 9. Emotional support is important. Weeks 1 to 4 can feel overwhelming. Hormones fluctuate. Mood swings happen. Fear and excitement mix together. Reassurance, love, and support from partner and family truly make a difference. A gentle reminder. In weeks 1 to 4, the heart is beginning to form. The neural tube is closing. Cells are dividing rapidly. This is a tiny beginning, but a powerful one. If this video helped you understand your body better, like this video, share it with someone trying to conceive. Subscribe for more evidence-based women's health content, because knowledge saves lives, and sometimes it creates them.